Let's talk about the 6 most important things I tell my patients after a C section. Hey, my name is Kara. I'm a hospital based mother baby nurse. I've been a nurse since 2018 and I'm a mom of 3. Number 1, most incisions are closed with internal dissolvable stitches. Outside, it depends on the provider and their preference, but it's typically a skin glue, it could be sutures, it could be staples. Always check with your hospital staff to make sure it's safe to do so, but typically you can shower post op day 1, which is the day after your C section. Majority of your bleeding after birth, whether you have a C section or a vaginal delivery, comes from where the placenta separates from your uterus, so you're still going to have a good amount or fair amount of bleeding. You never want to rub or scrub your incision site, just be very gentle with it, pat dry, and use a mild soap. Some providers will put an abdominal pad over your incision with like a clear adhesive dressing over it. Typically, although this will just depend on your provider, it's usually removed post op day 1 as well, just to let the area breathe. Your provider may use a product like the Abby to lift the lower part of your stomach off of your incision site. This allows the area to be well visualized, as well as prevents moisture and heat from building up in the area and just letting that incision site breathe. It can be worn in the shower and actually worn for up to 14 days, easily removed and reapplied by the patient at home if they want to. To restore the adhesiveness, you can actually wash it with a mild soap and water, towel dry it, and then reapply it easily yourself. It doesn't interfere with skin to skin or breastfeeding, and it can also be worn with an abdominal binder over it if desired. For more information, you can check their page or talk to your provider if they plan on using one. Number 5, you can use an abdominal binder, but it's important to make sure it's placed correctly. Generally, it's used well up and moving around. You don't want to lift anything heavier than your baby for the first 6 weeks. And be cognizant of body mechanics, such as you want to avoid twisting and being careful the way you're getting up and out of bed so you're not straining that incision site. And lastly, you still want to avoid tampons, sex, or submerging in water until you are cleared by your provider to do so. Generally, this is around 6 weeks postpartum. If you have any other C section tips, be sure to drop them in the comments below.